I'm Diane Degnan from United Methodist Communications. We've imagined no malaria, now let us imagine abundant health. That was the message to the people of the United Methodist Church at this week's General Conference as we celebrated the success in the fight against malaria and announced an exciting new initiative to reach 1 million children with life-saving health interventions. Here to tell us about that today is Dr. Olusimbo Ige, who is with the General Board of Global Ministries Global Health Program. Welcome, Dr. Ige. Thanks for joining us.
Thanks, Diane.
So tell us a little bit first about how you got involved in this area of global health.
I was born and raised in Nigeria, and for those who know a little about health in the world, you know that Nigeria is one of the countries with the major health challenges. So living with people daily with sickness and disease is not strange, but I had a real life experience when I was about 8, and I had come down with typhoid fever, which was really very frightening back in the days, and people died from it quite often. And I was fortunate to have a family that could afford to pay for my healthcare. But I had a friend who had fallen ill with typhoid, but whose family couldn't afford healthcare, and she died. And for me, it was devastating. You know, why would we live in a world where, you know, children will die from a preventable disease, and when they fall sick, they don't have access to healthcare? Why will I have that opportunity and no other child will have it? And for me, that was, the moment I decided I wanted to be a doctor. And I'm excited about the opportunity to work within the United Methodist, where I can bring my calling as a doctor and join that to my conviction as a Christian that every child has promise, and every child deserves the opportunity to live a good life, free of disease, free of sickness. And if we can do something about it, we should. So as the Director of Global Health in Global Ministries, this is a very exciting moment for us to be able to go on to the next stage after Imagine No Malaria, and then say to every child, there is opportunity for abundant health. And we're very excited about that.
Well, I actually had the opportunity to visit some hospitals in Africa when we were exploring the malaria program, and I was told that there are actually some other pretty simple diseases that sometimes have higher mortality rates, like pneumonia, for example.
Right.
What are some of the preventable diseases that children die from in Africa?
The top 5 causes of death for children under 5 in many developing countries include malaria, diarrhea, respiratory infections, malnutrition, and vaccine preventable diseases like measles. And we've focused for the past 8 years on malaria, and we've brought down the death rate for malaria by 65%. Our work in conjunction with the work of other global organizations working in malaria. And now we have the opportunity to expand the scope of our work to address other prevalent causes of death in children like diarrhea and pneumonia. And we hope that with that we'll be able to increase the impact that we've had and say to every child, I'm not going to only focus on malaria if you come to me sick. If you have other diseases as well, we will be able to respond. And that's what we hope abundant health will achieve. A broader scope of intervention, of health intervention for every child.
So we started with nets, and then we broadened that a little bit more to include more infrastructure,
Right.
and training of health workers and communication, and now we're moving on to the next bigger thing.
Right. And we're excited because Imagine No Malaria provided us the opportunity to work with partners, to build a structure, to show to the world what you can do as a church. Now there's confidence and there's motivation to do more. And we're going to be building on that success using the health boards that we've partnered with, using the health clinics and hospitals that we walk through Imagine No Malaria to provide additional interventions to children all over the world.
So where will you start? There's some pilot programs, aren't there?
Yeah, we decided to look at the 24 priority countries for child mortality And at the bottom of that list are some countries where we have a United Methodist presence. And so we decided to start with 5 pilot sites, and that's Liberia, Nigeria, Mozambique, Democratic Republic of Congo, Haiti, and also in the US. And that would be surprising to people to say that we're also choosing the United States as a focus for this intervention. I know not many people know that the rates of childhood obesity in US has more than doubled in the last 30 years. In adolescents, it's more than quadrupled. And we know that obesity is a precursor to many diseases, diabetes, high blood pressure, cancers. So here in the US, there's also an opportunity for us to support children to have a better quality of life. So while we select sites out of the US, we also want the US to be a site for abundant health for children.
And I think I heard you were trying to involve 10,000 churches.
That's right.
What do you want these churches to do? How can they get involved in this exciting new effort?
Right. We're calling on churches to reach out, to look in their communities and identify the prevalent, the priorities, health concerns that people have, and provide a haven for people to address health challenges, to provide education in healthy eating, in providing space for physical activity and exercise, support people through mental health challenges, and also advocate and educate about substance abuse reduction and prevention for children and for all. So we're calling on 10,000 churches to sign on to this health challenge and say we want to be a health promoting church. We want to be known not only for spiritual health, but also for promoting physical health and mental health and emotional health for our congregation and for our community.
Well, we've seen what we can do in the fight against malaria,
Right.
raising $68.5 million. Really exciting to see what's going to happen next and
Right.
how the United Methodist Church will work to better the health of children.
Right. So we are very excited. This is a multi-member denomination with incredible connection to each other. And we want to demonstrate to the world what a church like the United Methodist Church can do to improve public health, can do when we come together and say, we will do something in each of our communities. We will join hands together to support people beyond our communities. We will respond to global health challenges. We will not just lay back. We will not just sit down and say, oh, I wish. We will do something about the situations that are surrounding us. And that's why we're calling on churches to be creative. How can you challenge people to eat healthily? How can you encourage more physical activity? How can you support people with their mental health issues? How can we be that force of encouragement, of support, of accompaniment for people who grapple with serious health challenges? And that's what we're called to do as a church, and not just outside the US, but even here where we live and work. And we want our presence to be felt as a church, helping people to know that our reach is beyond our congregation, and we will respond when we see it. And so we're calling on churches to sign on to the initiative and be a part of this movement, to demonstrate to the world that Christ's calling is to be the salt of the world, is to be the light of the world, and to respond even to health challenges wherever we are.
Well, we'll look forward to hearing more about this in the coming months, and we appreciate you taking time to come by today and talk more
Thank you.
about this. Thank you for joining us in the Digital Lounge. This is a wrap. It's our last episode of the Digital Lounge, and we've enjoyed bringing these interviews to you from the United Methodist General Conference in Portland, Oregon. Thank you.